Welcome back to Chamber Exchange, the TV show. And again, want to thank our sponsors who help make the show happen. Bank Hometown, as well as St. Vincent Hospital. And pleased to have with us in our final segment, Dr. Amie Shei, who is the President and CEO of the Health Foundation of Central Massachusetts. Welcome.
Thank you. Great to be here.
So as we taped the show today, earlier this morning, we had Governor Healy here today at the Chamber's Breakfast Club with a record crowd of about 430 people, and we got to do some salutes, which is what we do at the Breakfast Club when we recognize important anniversaries and milestones for companies, as well as new presidents or CEOs of organizations. And we were able to recognize you a couple of years ago when you started in the new role. And then today we got to recognize the Health Foundation for an important milestone.
Thank you so much. It was such an incredible honor. We had our staff there, directors, community partners, and it was a wonderful event.
25 years.
Yes.
And maybe, that's a good segue for maybe you to kind of share with our viewers kind of the history of the Health Foundation of Central Massachusetts. You wrote a really nice op-ed in the Boston Globe recently talking about the Health Foundation and how sometimes when for-profits turn into nonprofits, they can be a benefit for the community. Maybe you can walk us through that.
Sure. Happy to share our history. We were created when Central Mass Healthcare, a non-for-profit physician-owned HMO, was sold to a for-profit company.
Okay. Yep.
And it took 4 years for the transaction to be approved. There was a lot of scrutiny and community engagement to ensure that the assets that belonged to the original HMO would continue to benefit the community. Mm-hmm. So we continue to use those assets to provide grants to nonprofits throughout Central Massachusetts. Our mission is to improve the health of those who live or work in Central Massachusetts. And we define health very broadly. And many of our projects address social determinants of health, including the one that we'll be talking about today.
So in that, maybe some of the projects that we had the pleasure to work and continue to do with the Worcester Regional Food Hub. Obviously, I think people could see a connection between food and health, but there's some other pieces that maybe people wouldn't necessarily draw that direct correlation. Mm-hmm. You've been very active on issues around water quality. Some of the issues around transportation, and maybe you could kind of talk about transportation and how and why you see that as a determinant and a health issue.
Sure. I think many people have traditionally thought of transportation in a very siloed way. Transportation relates to roads and buses and trains, when in fact, transportation is critical to so many aspects of our day-to-day lives, our well-being, our access to jobs, medical care, our social connectivity to get from place to place to connect with our community. So we really see transportation as a critical social determinant of health. When trying to improve health, people often think of health care, of medicine, of prescription drugs, when in fact about 80% of health is determined by these social factors or social determinants of health, including transportation.
Mm-hmm. And so one of the issues, and one of the organizations that was recognized alongside you today was the Worcester Regional Transit Authority. So we think of the Worcester Regional Transit Authority with a hub in Worcester, most of its services intensive to the city, and with lines that go out, but with less frequency than maybe within the city. So there's the issue of regional transit authorities. There's the MBTA, which is in Boston, which includes buses and trolleys and trains. And then there are communities in parts of the state, particularly our rural communities, which really have little or no. So you're kind of working in all of those areas.
Yes. We cover Central Massachusetts, all of Worcester County and some of the surrounding towns. So included in our service area is the city of Worcester, second largest city in Massachusetts and New England, and also some very small rural communities that have less than 1,000 people. And for these small rural communities, they don't even have access to RTAs, or if they do, it's very minimal. And so one of our major initiatives right now, the Quabog Connector, has really developed an innovative model of rural microtransit that we think is sustainable, scalable, and really should be a model for the state.
And when we say like microtransit, how would you describe that to someone like myself, a viewer, a layperson? Yeah.
It entails not buses like MBTA buses, but smaller buses, vans, sometimes sedans, and they're very flexible. So the Quabog Connector offers on-demand service. So it's not a fixed route, which often does not work for rural communities because not everybody is going to and from the same places. So individuals in the region can call. There's a dispatch service that books a ride for the individual. So it really is door-to-door service within the region. Helps people get to jobs, training opportunities, medical appointments, and more.
And one of the things that the Health Foundation of Central Mass is able to do is to be able to put some dollars to pilot, to leverage, to partner other dollars for these kind of types of trials or pilots. And that's kind of what you're doing.
Yes. Yeah, so we have invested about $2 million to date, and this is our 5th year of funding. And as you know from the Worcester Regional Food Hub, our funding does wind down after several years because we do try to spread our resources across the entire community on a variety of different topics. And so we really see this as an opportunity for the state to take a greater role in the Quabog Connector and also to replicate this successful model in other rural communities across the state.
Right. And we've seen just with the fare-free WRTA, and some of that data was shared today, is that the Worcester Regional Transit Authority has, I think, been the longest running free fare. So you've got really a good sample size that people are using it. And when you talk about economics and equity, discretionary income for certain people on the economic ladder is less than others, and so having that free service can save a few bucks and yet give that dependability.
Yes, it makes a big difference. We're very proud that the WRTA has now been fare-free for 4 years, and the Health Foundation has been involved in advocacy in support of that effort for many years.
Right. As is the chamber team, for us, it's about kind of that work, access to work and jobs, and that makes it better for the employee and the employer. Also, Transportation Funding Task Force. We can Alex Guardiola, our VP of Government Affairs and Public Policy, is going to be representing in that. And similar to your role, our chamber service region is very similar to the area that you serve. And it's, yes, there's urban, but we also have that rural piece, and they're all important.
Yes. Yes, I look forward to working with Alex on the task force, and it's great to have Central Massachusetts representation on the task force. Oftentimes these conversations, as you know, are concentrated in Boston, and it's important to continue to raise issues of regional equity, health equity.
Yeah, and the other thing I think is a little bit different about this task force and maybe others in the past is that there is some now dedicated revenue that will be coming in that's half education, half the transportation. So hopefully they can move the needle a little bit.
Yes, I hope so.
Good. Dr. Amie Shei, President and CEO of the Health Foundation of Central Mass. If you want to learn more about the Health Foundation, go to thfcm.org. Learn about the great things they're doing on a range of fronts.